Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guest is Dr. Erin Walborn of Audiologic Solutions. Welcome to the show.
Thank you. Thanks for having me.
What do you do for Audiologic Solutions?
I'm actually the owner. I started the business in 1997, and I'm an audiologist, so I see patients, test, treat, that type of thing.
And audiologists are doctors, right?
They are. Yes, they've changed the requirement. We now all have to go and get our doctorate in audiology to be licensed.
Okay. And today we're going to be talking about, is it tinnitus or tinnitus?
Either way is fine. It depends on what part of the country you come from. In the West, they pronounce it tinnitus. I tend to say tinnitus, so either way is fine.
Okay. And can you please define what tinnitus is?
Sure. It's different for a lot of people, but predominantly it sounds like a ringing, hissing, buzzing, clicking in the ear. It can be constant. It could be intermittent. Sometimes it can pulse with your heartbeat. Sometimes it might feel like a fluttering in your ear, like you have a bug stuck in your ear.
So it could be during the day, at night, when they're laying down, when they're standing up.
It absolutely can, and it's most noticeable when people are in quiet. In some cases, though, you will find people who hear it all day long through any amount of noise, and it can be very troublesome for a lot of people.
Okay. Now let's talk about causes. What are the causes of tinnitus?
Sure, there's lots of different causes. And as you can see on the screen, it lists all the different causes that there are. But just to mention a few of the common ones would be hearing loss, noise exposure, certain medications, sometimes stress or a head or neck injury can also bring it on.
Now, how could a medication cause this disorder?
Well, there's some side effects to all medications, and one of them can be tinnitus or ringing. And so there's a couple different theories as to why tinnitus is produced, okay? One of the theories is called Heller and Bergman. And basically what happened is these researchers put patients or normal hearing individuals in a soundproof booth who had no symptoms of ringing in their ears at all. And within a few minutes, they all had these symptoms. And the soundproof booth was called an anechoic chamber. So one theory is it's within everybody. It just takes something to make it noticeable, okay? The other theory has to do with hearing loss or discordant theory, and with just certain nerves. As you lose your hearing over time, certain little hair cells don't work anymore, and then you can kind of hear them firing in certain situations. So it just takes something to bring it out and make it noticeable.
Okay. So let's pretend that I'm a patient coming in for the first time and I'm complaining of tinnitus symptoms.
Okay.
What sort of evaluation procedure would you go through?
The first thing we would do is take a very detailed case history. I'm really going to ask a lot of questions as to what was going on in your life around the time that it developed. There may be things that we can tie in that you may not have tied in yourself, such as a lot of stress in your environment, a previous head injury, Lyme's disease, certain medications. So we're going to go through that. We're going to have you have a full hearing evaluation.
Okay.
After that, I am going to do a tinnitus pitch match and loudness test. So I actually put in sounds to try and match what you're hearing in your own head.
Oh, so that's how somehow you figure out what they're experiencing.
Exactly.
Okay.
Once I do all of that, I can pretty much figure out, for the most part, why you have yours. Because it's different for everybody. There may be a different cause. So if you told me that you feel like your tinnitus is a bug fluttering in your ear, that's usually a muscle in your middle ear that's in spasm.
Oh.
Stress management helps that. If you tell me your tinnitus gets worse when you clench your teeth, you bite down or you move your head or neck, that's usually something more with your jaw or the neck muscles. And massage, physical therapy, things can help that. So we really have to take each individual case as that and look at the full picture. An eval takes about 2 hours.
Now, does the level of earwax in somebody's ear have any effect on this?
It absolutely can. I have seen patients who've never had tinnitus become impacted with wax, and then it starts all of a sudden. So if your earwax is right up against your eardrum, that could absolutely make you start to hear tinnitus, and it's as simple as removing the tinnitus. One thing I do want to mention is a lot of physicians or other people I've heard say you have to live with this. There is no cure. And while there is no physical cure, what we can do with tinnitus retraining therapy is teach you how to live with it appropriately so it's no longer bothersome. So there definitely are ways to bring down the level of what you're hearing. And in some instances, if it is caused by earwax or by stress, we certainly can make some of that go away. So the moral is you don't just have to live with it. There may be some other options out there.
Okay. Now, are there some people that where the tinnitus drives them completely nuts, and some where they're aware of it and it doesn't really bother them too much?
Absolutely. It depends on the patient's personality as to who suffers and who doesn't, because you will talk to people all day who will say, I have that ringing. And in one day I had 2 patients, and when I matched their tinnitus, it was exactly the same pitch, the same loudness. And in one patient, he said, I've had it for years, it doesn't really bother me, I've tuned it out. The second patient, the same exact tinnitus, was suicidal over it. So there's a wide range of how people react. So we should talk about why do some people react so strongly and others don't.
So, one of the things I keep hearing from you is the emotional factor that's involved in all of this.
Right. So I want to talk a little bit about that because the people who suffer tend to have anxiety or depression.
Oh, okay.
Okay? So what I'd like to do is explain to you a little bit how the body works and why some people do suffer more than others. So as you can see from the slide on your screen, you're looking at a picture of the autonomic nervous system. And what you're seeing is there's 2 parts to it, the sympathetic and the parasympathetic part. You need both sides functioning equally to be healthy. All right? So on one side, you're going to see that there's the fight-flight. And then that side is actually controlling more of your stress hormone. And if you think back in the cavemen day, when they were stressed, the fight-flight response was to help them survive.
Right.
But in order to get out of that mode and go into the other rest and relaxation part, they would run. They would run away from the animal or go hunt the animal that was scaring them. And that released all of that pent-up stress that was in there. We aren't doing that these days.
So you're saying cavemen didn't have tinnitus?
I'd love to know if they really did. I think they probably dealt with it. It's interesting, though, because it's also your thought patterns. So if your thoughts are always in the future or in the past, so if in your head you are thinking, oh, I have to do this, this, and this, or oh my God, I can't believe I did that. If you're not in the present moment, your body is actually functioning on what you're thinking, not on what you're physically doing. So if you were on vacation sitting on the beach and you're sitting there soaking up the sun, it looks like you're actually in the rest and relaxation phase.
Right.
But if your thought patterns aren't there and you're reliving something in the future or the past, you're planning out events, you're stuck in that fight-flight mode. And now the body is producing more stress cortisol, and it's making the tinnitus louder.
So cortisol should not be allowed on the beach. Is that
No
what you're
cortisol
saying?
on the beach.
So it's all
Relax.
about changing our thinking.
Correct. That's a good portion of it. It's not the only answer, but that in addition with some sound therapy will definitely help a patient not to be so suicidal over it.
But there aren't medications that are used for anxiety or depression disorders that are used to treat tinnitus, right?
Well, things such as Xanax or Klonopin, they may treat the underlying disorder, but that's not going to cure the tinnitus.
Okay.
Okay?
That's what I was wondering about. Okay, and if somebody is more stressed, then they're going to be more affected by tinnitus.
Correct.
Okay.
Now, especially if you have hearing loss. If you have hearing loss and tinnitus, stress really is also adding to the factor that you're also not hearing things clearly. And what we need to do is amplify in the area where there's damage, where the tinnitus is. Because by bringing sound back into the damaged area, we can a lot of times eliminate the sound of your tinnitus while you have the hearing aids on. That's one therapy that is very effective. Doesn't work for everybody.
Okay.
And it also obviously won't work for people who don't have hearing loss. But there are other treatment options for them.
Now, can you talk about the practice of mindfulness and how does one person approach this?
Absolutely. So what mindfulness is just trying to live in the present. So the first thing you need to do is look at your thought patterns. If you are, again, thinking about the future or the past, be aware that you're doing it, know that it's not normal, and bring your attention back to something in the room that you haven't noticed before. So in this room, I might say, wow, I didn't notice there was a yellow chair sitting over there, right? So it's just bringing your attention back for the moment and recognizing that you're doing it. That's going to be the first step. The second step is breathing. A lot of people with stress or anxiety, very anxious, they breathe from the chest up, and that actually promotes more anxiety. Actually, it's belly breathing that you need. You need to be breathing through the belly, longer, deeper breaths. And those are some strategies that can actually help in addition to some type of sound therapy.
And I know that one of the things that's a popular thing in our library is people asking for meditation information. So we have music CDs and we have books and DVDs.
Perfect.
Things like that.
A lot of people will tell me they can't meditate with their tinnitus because they hear it so loud when they're in quiet. So one of the suggestions I would do is meditation is fantastic, but I would put on some broadband noise. So you can buy sound generators at Brookstone, at CVS, and those are, you probably even have DVDs here in the library that have the sound of the rain.
Yes.
Sound of fan noises. All those environmental sounds are excellent. So what I would do is play that in the background at a low level. You want it set very low. People who are in noise don't hear their tinnitus as loud.
We have a new age music CD collection, so
perfect.
Yeah,
so that would be
would
be great. Get that, put that on a low level in the background. Don't turn it up so loud that they can't hear their own ringing.
Okay.
You still want to hear the ringing because we're trying to teach the body that it's not a dangerous signal. That it's just something that's there because of a misfunctioning in the wires in the brain.
Okay.
And that it's not danger. And we need to teach the body that.
And I know that I have an iPad at home, and I have also a smartphone.
Yeah.
And there are multiple apps or
Absolutely.
applications out there
Yes.
that people can grab, right? Just
for
for white noise.
Exactly. So that's one of those things for people who have normal hearing who have this. Pick up an app, grab a CD from here, a DVD, anything that has those types of broadband sounds. You don't want to be in silence. What you want to do is know why you have it. So the first step is an evaluation, just to know why you have it. In some cases, it could be a medical sign that something's going on. So we do want to rule out anything medical causing it.
Okay.
But once you have that, then you can come and there's so many things that are available to help you. And audiologists will guide you as to what's available. It doesn't have to cost thousands of dollars.
You know, what's amazing to me is the number of ailments that people go through in their lives, and they're never evaluated for any of them, and they just think, I can't do anything about this, I just have to live with it.
And you don't. And sometimes when the doctors tell you that, it's just because they haven't had the time in their own practice to research everything that's out there now. So we specialize in tinnitus, so we can lead you into the right path. A lot of audiologists are treating it now. So there's so many options out there. So that is the main thing. Keep asking. Don't give up.
That's right. And if you don't like one provider, this is what I tell the people that come in, find someone else.
Absolutely.
But how could someone not like you? But I'm just saying,
Yeah,
they think that they're stuck if they don't like the person that they're with.
And they're not.
They can't go anywhere else.
That's right. And
But
keep
guess
asking your
what?
friends.
There's yellow pages. Go anywhere.
That's right.
Now, what about emotional freedom technique? Can you please define that?
Sure. EFT is emotional freedom technique. It's called tapping, and you can find this. There's a lot of information online through Google. You may have some books in the library on it, but it's a type of system based off of acupressure or acupuncture, and it's
Okay.
using physical. So just by doing this, tapping the side of the hand.
Tapping the side of the hand.
That is the quick and easy way. And what we're doing is we're trying to clear energy fields. So, and I'm sure there's plenty of books downstairs about the energy fields, your chakras and whatnot. Our body runs on energy, and there are definite blockages in certain parts of the body. And we don't always know where those blockages are. But emotional freedom technique is being used with veterans for post-traumatic stress.
Okay.
We've used it with patients who are afraid of heights or have fears or phobias, physical illness. I did just this when I was getting a migraine and didn't have my medicine with me, and it would hold it off. So I can't tell you exactly how it works, but if you're feeling very anxious, very emotional about something, your tinnitus is driving you crazy, or you're just very, very emotional about something, you can just start with this. And that alone is going to help. There is a technique where you tap on different parts of your body and you use certain phrases. Even though I feel anxious about my interview today, I still love myself. And you would say something like that 3 times, and then you would tap on the different spots and say anxious, anxious, anxious. And you would go through these and verbalize them. There's a great stress therapist in our area who taught it to me.
Oh.
Her name is Barbara Stevens.
Okay.
And she's in the area, and she will teach people that, and you can get some information as well on Google.
Well, as the consumer health librarian at the Colonie Library, I have to caution people.
Okay.
If you're going to Google something, just be careful of the source of what you're looking at.
Absolutely.
Is it authoritative? Is it out of
Absolutely.
date?
Correct.
And do they have an agenda?
Excellent
So-
point. Excellent point.
If you're going to Google, be careful.
Is it something that they could come in and a support staff could help them if they didn't know how to
Absolutely, absolutely.
tell? Perfect.
Anyone could just come to the library and ask for me. They might not see me
Excellent.
out in the library, but I'm usually in the back
Great.
or make an appointment.
Okay.
Okay, one other treatment, sound therapy, how is that done?
Okay, so sound therapy can be done in many ways, and we talked about this already, but it's hearing aids, it's using free apps that are out there. Sound therapy is basically using a type of broadband sound, whether it's the white noise, the rain, but it's also using appropriately fit hearing aids to the tinnitus pitch. Wherever you have that tinnitus, when we found it, we want to give you a little extra volume there with the hearing aid, so you don't hear that internal firing anymore. And in most cases, just that alone reduces it. They do now make combination units that play a white noise through a hearing aid.
Ah.
They also play some relaxation music now through hearing aids. So there's lots of different things. It's not so much the device you choose as the counseling that goes along with it and who's fitting it. And that's key. Because if you just go and buy online hearing aids and think that's going to cure your tinnitus, it's probably not if they're not fit properly.
Well, how do you buy anything online if you're not evaluated or going through any kind of testing?
It's interesting. I just got news that United Healthcare has, in order to provide cheaper services to patients, has gone with an online, it's an online mail order company that does hearing aids. You mail them your hearing test. They will pre-program a hearing aid and mail it back to you. There are no service members in the area to service these people. They're not taught how to use it. If they have a problem with their programming, they have to mail it back. So you're still spending money for services that you're not going to be getting, and it's going to be a waste. And that's one thing that hopefully patients would do their research and know that that's really not a money saver. It's really not appropriately fit, and that's not going to solve all their problems.
Okay. Well, you may not know the answer to this, but for Medicare patients, are you aware of what is covered and what isn't during all of this process?
Right. Medicare will pay for a baseline hearing test.
Oh, thank you so much,
And
Medicare.
yeah, that's just the very first test you've ever had in your life. They will only pay
Okay.
for additional testing if you have a medical problem, like a physical problem. I have fluid in my ear. I need medicine for it. I'm now suddenly dizzy. I've had a sudden change in my hearing. But if you know you have hearing loss and it's permanent, they aren't going to pay for any repeat testing.
Well, what about tinnitus? How do they feel about that?
Most people don't recognize tinnitus as a code
Physiological
yeah.
problems.
So there is now a code we can use to try and bill some of the testing, but some of the retraining therapy that we offer is not covered. That's $75.
Okay.
So, to start out, to learn why you have it, we try and bill part or most of all the testing to your insurance. There is a $75 component that is not covered by any insurance because audiologists are performing almost like a counselor's work. And audiologists aren't recognized as a social worker or a psychologist, but it's tied in, so you can't really separate the two.
I'm really amazed in general at how little is covered when it comes to hearing loss, even for the hearing aids.
Absolutely. I think it will get better as we're starting to see some companies are offering, like United Healthcare, Empire State workers get $1,500 per ear. Certain GE healthcare workers are getting 100% coverage.
Good.
A lot of the other plans, though, that we see cover nothing. I think as people complain, as people start saying that's important to me, you'll start to see some benefit. We just don't know what's going to happen in the future with insurance, and are they going to be putting out more money when everyone's losing money? So.
Oh boy. Okay, so for further contact information, can you give a web address, please?
Sure. They can go to www.audiologicsolutions.org.
Okay.
And on there, we have a section on tinnitus, and it will talk a lot about what is tinnitus, how is it treated. We actually have some different forms on there that could be filled out to kind of help guide you. One is called the Tinnitus Handicapped Inventory, and it asks about 25 questions.
Okay.
And it teaches you how to score it. And it will show you if you score a certain grade on it, you need to come in for an evaluation because you're suffering. If you score less than a certain number, just knowing why you have it might be enough, and you really don't need much more than that. So that's right on the web, on our webpage.
Okay.
And patients can call us as well at 518-283-6111, and we'd be happy to give them some more information.
And where do you have offices located in the Capital District?
We have 3 offices. One is located in Mercy Care behind St. Peter's Hospital on the 1st floor in Albany.
Okay.
One is in Rensselaer. It's technically Rensselaer. It's East Greenbush. It's kind of near the Cracker Barrel off exit 9.
Okay.
And one is in Hudson, right on Warren Street.
All right. Well, thanks very much for coming in.
Thank you for having me.
Dr. Erin Walborn.
Thank you.
Thanks for watching. We hope to see you next time on Focus on Health.